Can physicians who fundamentally disagree about medicine still build something meaningful together? Not just coexist, not just tolerate each other, but actually build something that lasts. Today, I'm joined by two physicians who come from different paths, different experiences, and different vantage points, and yet they're both deeply committed to strengthening medicine from within. Dr. Zhen Chan is a pediatrician, physician entrepreneur, and people connector who focuses on healthcare improvement through innovation and community. Dr. Gregory Adaka is an emergency physician, medical director at Miami-Dade Corrections Health Services, keynote speaker, and author. If you're a doctor, healthcare leader, or patient, you belong here. I'm Kim Downey, and this is Stand Up for Doctors, conversations at the intersection of connection, courage, and the future of healthcare. Zen, Gregory, I'm so glad you're here.
Glad to be here.
Yes.
Thank you so much for having us.
You're welcome. And what would you most like our audience to know about you as we begin our conversation? Gregory, would you like to go first?
You've already said practically everything about me. But yes, my claim to fame is that I've practiced medicine on three continents. Uh, Europe, obviously, the UK, I practiced in England and a bit in Northern Ireland as well. I practiced for 5 years in Nigeria, that's in West Africa. And I've been in America now for 11 years, practicing, obviously, in the North American continent. So, yes, that's my claim to fame, apart from the fact that I've worked in more than 40 different emergency departments, most of them in the UK, doing various locums, and different times I moved around from one place to another. So, yeah, there you go.
That's fascinating. We could probably talk for hours about all of that. Right, Zen?
Sure.
Yeah.
And Zen, what would you most like us to know about you?
Well, I don't have the expertise that Dr. Adaka has built up already, but hopefully one day I will. I think
Don't flatter me, it
the
doesn't
people
work.
connector part that the people connector component that you mentioned is one of the things that I am most passionate about. I really, I want to bring that humanness, that joy back in practicing medicine, and I think a lot of that needs to come from making the world a little smaller and having us know each other just a little bit more, a little bit better. And so on the one hand, that's something I'm very passionate about. On the other, I love to be known as someone who's very passionate about children's health and pediatric healthcare access. So I'm trying to blend both my business background and my clinical background into improving both the physician workforce and pediatric health.
Well, and of course, I love that. I'm a pediatric physical therapist by training, and then I've become quite a connector also. And I love that. And I'm looking forward. I think I'll get to see you at the Dr. Lorda Breed event, hopefully in a couple weeks.
I hope so. I'm
Okay.
still working some kinks out in the schedule.
Okay, because we were supposed to meet up last year, and that I think we
I
were
know.
both there, but we didn't actually connect. So hopefully it'll happen, and we can celebrate by the release of this episode.
Absolutely.
Nice.
And, and I like to start with a powerful story, and I usually leave it open-ended, but I had a suggested question, but feel free to answer this or just share your own story. So, Gregory, can you share a moment when engaging someone with a different philosophy actually strengthened your practice or sense of purpose?
Wow. Wasn't expecting that. I thought I could dig into my rich past and throw you something out there. But
No, you can. Why don't you could do that first, and we
no,
can
no.
get into this later.
I'd go with that. So your question was, when was there a time where I interacted with someone that and their difference in philosophy impacted my practice?
Mm-hmm.
Hmm. Hmm. There have been many times, I can say many times, because I worked in emergency medicine, and maybe Zen could even speak to this because if you do any pediatric medicine, is that you meet so many different people from so many different walks of life. And that's one thing that Jenny across the board has impacted me because I'm here treating the patient in the emergency room for this, that, or the other, but you get talking and then you find out more about their culture, their philosophy, their worldview. And after 30 years and several countries, I find I've heard so much about how people see the world, and many of them so differently than I do. Most of them have been patients, but some of them have even been colleagues, fellow doctors, and they tell me what they feel. We get into conversations. How has that impacted the way I practice? I think what it's done is enable me to have, one, a greater empathy when people come up with things that I remember myself as a younger doctor, straight out of medical school, that sort of thing, where I would have had little patience for some people expressing their ideas, their views about certain things. But as I got older, maybe it's age, but a lot of it is just because, yes, you do interact with people who are from different walks of life and different cultures entirely. And then you realize there's more to life than what you thought you knew in your narrow worldview, and it broadens your mind. And that's enabled me to have, I would say, a bit more patience with people, with patients,
Yeah.
and patients' relatives,
Mhm.
understand their point of view. And that enables me again to reach them differently than how I would have done it, say, 20 years ago, as a younger doctor, when I'm trying to even convince them that I believe what I have for you is better for you. I'm the doctor, listen to me. I know more than you. I'm
Mhm.
more superior and all that. But I still am able to tell them this is what I believe, and they're better able to receive it if they know that I understand where they're coming from. But that took a few years for me to understand that.
That resonates with me so deeply as a physical therapist, whether I was advising patients' families or I did spend 7 years working in nursing homes. And if I would suggest things to patients, and then sometimes if they don't follow through, you're thinking, why didn't you listen to me? But now, having recently had cancer 3 times, right, and then other
Oh,
medical complications, even very recently, one of my doctors wanted to send me to another specialist, and
mm,
that made 44 doctors. So at first, like, I wasn't concerned,
gosh.
and I was like, no thanks, I'm good, right? But then my primary care doctor said he thought it was very important to see this specialist to rule out anything severe. And then I was like, okay, wait a minute. I really trust my doctors. I love my doctors. And I could think back to how I was frustrated when my patients didn't, like do or want to
Yeah,
do what I was recommending. And I was like, I want them to know that I trust them and I'm going to go ahead and do this thing that I really don't want to do. So
yeah.
I feel like that's deep in my perspective, where when I was, before I really felt like a patient, I don't think I had that same perspective. But then I shared with that the referring doctor, I says, like, I can trust you and not want to do the thing. Right? Both things can be true at the same
Both things
time.
can be true. Both things can be true.
Correct.
Hmm.
Yeah, yeah.
Hmm.
So thanks for sharing that. And Zen, anything this brings up to you, and if you would also like to share a moment when engaging with someone with a different philosophy, strengthen your practice or sense of purpose.
Yeah. So from a patient perspective, in any field of medicine, you're always meeting new people. I think in pediatrics, what's unique about it is you're always going through this proxy figure, right? The parent, the guardian. And that is an extra layer of education, figuring out how to use the right words for persuasion,
Mhm.
and coalition building with the family, that is just unique to pediatrics. And when we talk about things like vaccine hesitancy or uptake of certain nutritional plans versus others, and what all these wellness influencers are doing on social media that may not be scientific, but they're selling them, and it's very marketable. That
You went
people
there.
yeah, people accept these things and they come in with a completely different worldview about how to properly take care of their child. And so I take every one of those encounters as another, lesson to learn about how I can improve my craft of speaking, right? And
Mhm.
and patient care. But I want to say, in terms of a colleague, one of the reasons why I went this entrepreneurial route so early, to go into the startup world, to understand what people were doing in the healthcare industry outside of practicing medicine. I think in residency, I was just slowly seeing that this was a machine that wasn't well oiled. And I was just very dissatisfied by the way we were delivering care. And there was one individual who was a superior of mine, who it was a very busy ER day. There were a lot of workflow issues. People were short-staffed and short-handed. And I was like, okay, I think the actual thing that I can do to get this patient out of here so that another patient can come into a bed is let me wheel this person over to radiology myself and
Yes.
get the X-ray done. And I would think most old school docs would be like, this person's taking things into their own hands. Great, but I got the feedback in that moment in a room with other fellows, residents, attendings as well. My superior like kind of held me and said, "You're a doctor. I need you to focus on doctoring."
Yeah.
As in, this is a workflow issue that has nothing to do with you. So I need you to see patients. That's your job. And it made me really just rethink, what does being a doctor mean? And I felt I had both the desire and the skill set to work on some of these back end systems level problems. And it was one of those where that philosophy and my philosophy just didn't vibe at all. And it really made me kind of was like that last straw to push me to network and meet other people in industry and see how can I impact this and make the whole thing better.
Hmm.
Hmm.
Yeah, that is a
Wow.
really, powerful story. And it does make me think of when my mom's surgery was delayed. We share a surgeon together, and that he came in to let her know and check on her. And for whatever reason, she was allowed like some sips of water or something. And he went, and my mom said this, like, he went and got her a little water himself. So people could say that's not a
Yep.
doctor thing. But I love the fact that you did that, and I would do that myself. As a physical therapist in the nursing home, if I was
Yeah.
able to do something to help the patient in that moment,
Yeah.
I would do it, and that's the way it should be.
Hmm.
When you have the bandwidth to do that.
Hmm.
So that's such a good story, and I feel like two things that you've both brought up already are like empathy and communication, right? Because
Mm.
Gregory mentioned empathy. And I've recently been in conversation with Eva Minkoff. She wrote a chapter in one of our books, and we've talked about like doctors, like that means not necessarily putting yourself in their shoes in the moment, but being able to identify with the feelings that they're feeling because you felt those feelings too, right? Maybe you
Mm.
haven't lost a child or had cancer yourself, but you've felt fear, you felt sadness. So just being able to identify or recognize that this patient is feeling fear or feeling sadness.
Mm.
And then
Right, right.
communication skills. Yeah. So, Gregory, anything this brings up for you, but also I do want to give you the opportunity to share a story if you had one in mind. Another one.
Well, let's just go with the flow. Well, what I wanted to mention, it's not really a story, well, it is a story of sorts, and it's from COVID, which I think impacted all medical professionals, not just in America, but around the Western world and other parts of the world that were hit by it heavily in 2020. And in all my years of practice, that was the one year, 2020, where it was more of an upheaval than anything else in my practice. One thing that stood out to me was how when it first started out, it really brings mixed emotions. Even now, when I think about it, when it first started out, the medical community, we were seen as heroes during the first wave in the spring of 2020. And by the summer of 2020, there was a lot of pushback against what we were saying needed to be done. We're still being championed as heroes, but later on, I would say certainly by the fall of that year, in many quarters, medical people were seen as villains, pushing an agenda, trying to make money off it, being part of some larger conspiracy theory. Not everybody was thinking that, of course, but it was amazing how there was that mix. On one side, being patted on the back and being given accolades, more accolades than I had received for my job than I had ever had in my career. Like the whole world was looking at you, oh, you're a doctor, oh, you work in the ER. What, in Miami? Gosh, it's one of the hotbeds, one of the centers. And
Yeah.
to me, it's just another job to be done. But when they flip that and say, you're one of the ones, these are the people who are doing this, they're the ones, they're making money off it. And then it was cruel. And it was just that flip.
Yeah.
I found it confused my emotions. Let me say that. Confused my
Mm.
emotions, especially when you see the reality
Yeah.
of what was going on in the emergency room at the time. And you step out on the street back home and dare to turn on the TV and you hear people talking absolute nonsense about what's really going on. And you've just come from an ER with, I don't know, 114 people in the waiting room and 24-hour, the longest I had was a 32-hour waiting time to be
Yeah.
seen by a doctor, not 32 hours in the waiting in the ER,
Yeah.
32 hours to be seen. I came in on shift and I was the doctor who saw him. He had been in the waiting room for 32 hours. He was 80 years old.
Yeah.
And I got him, and then he saw me. Why was he in the waiting room that long? He's been there for
Yeah.
32 hours, eating our sandwiches, using our bathroom, living there for 32 hours. The waiting room, which is its capacity was officially about, I think, 45 people, but on the screen we had 114 people in the waiting room. And most of them, I guess, just get fed up and would
Wow.
leave. Some of the coughing, sneezing, really sick people,
Mhm.
but there's no room. What do you do? We're taking care of COVID
Right.
patients. That
Yeah.
was maddening. And
Right.
then
Right.
people out there saying it's all fake and stuff like that. So that was a strange time for me.
The gaslighting was just like the most maddening piece, right?
Mm.
Because you're like, I'm literally living through it. How can you, as someone who isn't in
Not even
this
there.
healthcare setting,
Mhm.
right? And I think it even boggles my mind even further when it is someone that is like working in a healthcare setting and maybe they are just from some place that didn't get impacted as heavily.
Mm-hmm.
But it just blows my mind when there's like COVID deniers or things like that within the
Yeah.
healthcare
Yeah.
that
Within
are
the,
healthcare
yeah.
workers themselves. Yeah.
Mm-hmm.
Right, right. Well, I just want to say I'm sorry for your experience and oh my gosh, like going to work every day, knowing that you could die, you could get the virus or something, and just still showing up. Like, I think we just owe such immense gratitude to the physicians who kept showing up. And I did interview a pulmonologist, and he separated from his family for 4 months. And,
Yep.
he lived in the basement. His wife would
Yep.
leave food at the top
Yeah.
of the stairs.
That's it.
And it really impacted, physicians and their families. So just, thank you once again to, you guys and all doctors who showed up then. And it's important to acknowledge and recognize that. So just thank you and I'm sorry for that experience. And that's why I have these episodes for doctors to share their stories and right and raise awareness about these things. Um, so I know Zen, she kind of spoke to this already. Another question I wanted to ask you guys was, have you ever felt professionally isolated because of your beliefs, values, or approach to care? So Gregory, is there anything you'd like to add? And then Zen, if you wanted to chime in after Gregory.
Uh, well, fortunately, I've not had the experience Zen had where you're pushing a patient to the radiology or x-rays and then somebody taps you on the shoulder and says, no, you ought to be doing this instead. Well, I've had it much milder where I'm trying to draw blood off a patient, for example, and a nurse comes in and tells me, Dr. Adaka, you really, and this is more in America, come to think of it, because in the UK, this
Mm,
never happened.
mm,
And it's more, and the tendency here to everybody needs to do his job so things can move along smoothly, like a
Uh,
supposedly well-oiled machine, which is not. But there's a lot of pressure to get things done within your realm, and please ignore everything else. Somebody else will do that job instead.
yeah.
And I discovered that when I came to America back in 2014, because I just wanted the nurse is struggling or the phlebotomist can't do it. I'll do it. In England, doctors do bloods all the time. So I draw it, but I'd be told by a nurse, the time you took doing it, you could have been seeing another patient, and the waiting room is busy, that sort of thing.
yeah.
So yeah, something similar, but not in the way I'd been say rebuked for it. But I guess I just sort of learned that in this system, there's some things I just had to let go and let somebody else do it, so that I could do what they want me to do, to see the next patient, move on.
Mm-hmm. Well, and it's just constantly those decisions because this is even bringing to mind small things. So, say I was in the nursing home, went to see a patient, and they told me they have to go to the bathroom. And then you're like, oh
Mhm,
no, like you don't
mhm.
know what to do. Like, do you have them press the call bell, wait for somebody, or do you try to see another patient, but then you're already a minute or two into their treatment time? So then,
Yeah.
like, well, I'll help you
Crazy,
go to the
crazy.
bathroom and I'll perform the transfer and we'll count that. But then while they're sitting on the toilet, you can't be billing for that, and it's like all those like
You just want to be
things.
Yeah.
human. You just want to be
Yes.
human. Can I just be human and do what a normal human being would do with the skills that I have, and leave all those silly check boxes that says you haven't done this, you shouldn't do this, somebody else should do that. We're not a factory. We're a hospital. But
Right.
there
Yes.
you go.
Yeah.
100%.
Go
Mm.
ahead,
I
Zen.
was
What would
gonna
you
I
like?
was gonna add that one of the difficulties for me was that I had this sort of more systems level view of how we were practicing care. And so it was just a little bit difficult for me to find connections and mentors in my direct network at the time because I didn't have
Mhm.
one, right?
Mm.
And so, having to build that on my own and having just like one program director I will never forget, like she probably sparked my networking journey because she gave me that first introduction to someone that worked in consulting and did a little bit of bench research, was pursuing his PhD, yeah, that was the first networking opportunity, and then I just kept on going one after the other, and I sort of built my own network
Mm,
to access those mentors and get good advice. But that was a little bit of a struggle to try to match what I wanted to do and how I thought about things with everybody else. But I think everything turned out okay.
I love that. And I think that's some of the things that we are trying to do in this space is make connections, right? And form a sense of
Hmm.
community. And that'll make
mm,
all the difference and help connect doctors who are trying to innovate and support doctors who are struggling. So I love, what each of you are
Hmm.
doing towards that. And so what would you say is the cost to physicians when we avoid conversations with colleagues who think differently? Gregory?
mm. Well, I guess that reflects to what I started off with, doesn't it? If you avoid conversations with physicians who think differently, then you never learn how their heads work, and they will never learn how your head works. And so you create a barrier, or there's already a barrier, and you make the barrier deeper. The longer you work with someone and still don't know how they think, and they don't know how you think, it's just going to cause that challenge and that difficulty. And what you're denying yourself is an ability to learn, to expand, to be a more wholesome human, because no matter how different we are, unless the patient has got a psychiatric disorder or the doctor has got,
Mhm.
a significant personality disorder, well, then they're on the pathological stage of
Mhm.
differences in the way people think. If they're not, if it's just a cultural thing or just a, I don't know, a worldview difference, if you, their view, so to speak, is as valid as yours, even though from your
Mhm.
point of view they are not right. I always say, what sticks can you spit out, and the straw that you can take? What good can you extract from their point of view? As much as you want them to extract some good from your point of view, but that can only happen if you're opening up and share your differences without getting too argumentative. Unless you enjoy a good debate, like I used to have when I worked in a village up in the north, the Panhandle, and me and two of these nurses. One was a nurse, one was a radiographer, and we had significantly different worldviews. And it was a tiny hospital, so I'd be the only doctor on at night, and it's quiet, nothing's going on, and we get into our debates and we're shouting and screaming at each other, but we loved each other. And in the morning, the nurses would come and wonder, what did we argue about last night? Oh, here's another thing, here's another,
Yeah.
and we got very close,
Mhm.
despite our social political differences. And in that, oh gosh, how long was I there? 4, 5 months, 6 months? I learned so much more about what these other people think than I'd ever learned, say, I don't know, in years before, and they, I'm sure, the same from me, because I mean, he even said it. So yeah, you don't know what you're losing if you keep those barriers up and
Yeah.
refuse
Well,
to
Yeah.
listen.
that's fantastic. And that reminds me something else that Eva quoted in our book. And she's the spouse of a physician and a chronic patient and involved in
Ooh,
healthcare. So she said, we're both human, connect from there. Right? So it's
love
kind of
it,
like
love
summarizes
it.
what you just
Yeah,
said.
just start with that. At least we're both human, right? Yeah,
Yeah,
Yeah.
yeah,
connect
yeah.
from there. I love
Yeah.
it.
Go ahead, Zen.
I, I I like to think that like yeah, in that case, right, Dr. Adaka, you and the radiographer, um, you both have the best intentions. You want to have the best come out of the system. You just disagree on how to get there. And so
Mm,
at least coming from that frame of mind that hey, this person's well intentioned. We just got to figure out how to get the process right. I
yeah.
think that helps a lot with these conversations.
Mm,
I also do wonder, and because I agree, I wish these types of debates and conversations happen more in the work setting.
Mhm.
And I do wonder if the way that at least American medicine has become and our system has become, um, it doesn't allow you to even have the time to do it
yeah,
Mhm.
yeah.
because they're like in the right it's the same vein as the nurse's job is this, the LPN's job is this. It's not even just nurses anymore, it's LPN and like
LPNs.
they all have
Oh
their
gosh,
certifications, and then like this is
structured,
the tech's job,
structured.
this is the physician's job. And I think it comes from this like more corporatized right view
Mhm.
of a business where everybody should do the max of what their job description is. And if you do that, then this can generate as much revenue and profit as possible,
More efficient.
right? You,
It's more efficient,
exactly.
supposedly.
Mhm.
Efficiency, supposedly, exactly.
Yeah.
And I don't think that that works as optimally as it does at a Subway or a McDonald's, as it
Mhm.
does
Mm,
in they're trying to push in healthcare. And then when
yeah.
you do it that way, the physicians, the nurses, everybody that's seeing patients, we're so busy. You get into this mindset of like, I just want to go to work, get my work done, and then go home.
Get
Because I
out.
also have
Yeah.
home priorities, family, right?
Mm,
Everything else, my other interests.
mm,
So I wish the system understood that a little bit better, and more physicians, right, get into those decision-making rooms, to say, hey,
mm.
we need more academic hours. We need more other things to have these conversations again.
Absolutely.
Yes. So I had interviewed a while back Dr. Stephen Palanchuk, and he's a pulmonologist and critical care physician in Canada. And he started something where once a month for 1 hour, the doctors and nurses kind of have like a powwow, like in a room together, and then they get to know each other as
Yeah.
people. And I
Yeah.
asked him, well, did you ask the, like healthcare leadership at your hospital if you could do that? And he's like, no, he just did it, right? Because it's better to like do it and then ask forgiveness instead of like ask
Uh,
permission. And that
Yeah.
kind of speaks to the time that you're saying. And you're right. It's, when it's gotten worse over time, like it didn't quite used to be like that, right? There was a doctor's lounge, right? And the
mm,
doctors could just chat about, difficult cases. And even
Hmm.
us as physical therapists, we more enjoyed lunch and camaraderie with each other. But then with the EMR, I shared that I've, eat a sandwich with one hand and type with the other hand. And some of those conversations, went out the window. So as we're winding down, if we were modeling the future of medicine right here across generations and perspectives, what would we want physicians listening to feel permission to do differently tomorrow?
Hmm.
I'm gonna rip off Zen on this one. I think
Yeah.
I would prefer that a physician could be a whole human at work and bring his humanity fully within reason, obviously, but fully within his clinical scope of practice. So if you see a patient who needs to go for x-rays and there's a delay because the porter is busy with another patient, that you will not think twice about saying, I'm going to wheel them down the hallway myself, get it done, I'll be back in 5 minutes, pick up the next cart and see another patient. That should
Mhm.
not even be something that's an issue. It should be just a done thing. And if a resident comes to me and says, there's this patient here, he's been waiting here for 10 minutes for the porter, what do I do, Dr. Adaka? I need to see somebody else. I'll look at them and say, what do you think? What if that was your mother? Would you leave them sitting there? Now, I'm going off on one now, but
Yeah.
that's the way I think we should be able to practice. And not only us, but we should teach our residents and our medical students that this is the way it works. This is the way it should work. It will be, in a sense, even more efficient because people feel heard, people feel understood, patients become more cooperative, nursing staff and ancillary staff become more helpful to you as well. We all, if they feel we're all pulling together, that's what I would like our physicians going forward. I would like our practice to be.
Yeah.
Yeah.
Well, I love that, and that's why this our most recent collaborative book is White Coat's Human Hearts: True
Mm,
Stories of Healing, Belonging, and the Courage to Stay Human in Medicine. Just to what you said, doctors should be able to be whole humans at work, and that even includes if they're having struggles at home, that you don't
Mhm.
have to act like everything's okay. You should be able to say, I had a rough night. Like I had a recent conversation with the doctor. I'm like, oh, how are you doing? And he's like, oh, my kid was up at, 2 o'clock in the morning, so I'm tired. And like, that's okay. Like, you're a human being. And to be
mm,
able to say that, and then other people might be giving you a little bit more grace, right? Than if you
yeah,
just act
yeah.
stoic or feel like you need to act like a robot or automaton or something.
Mm.
Mhm.
Zem, what would you
Mhm.
like to add?
That's such a good answer. So it's a little hard to follow.
I stole his thunder.
I
I stole his thunder.
Yeah.
I got it from
I
Zach.
and maybe some I know for a fact many doctors might disagree with this, but I would like to see more grace and permission being given to doctors, especially young ones who might also have other interests, right?
Hmm.
And it could be something in the humanities department, like in photography or poetry. It could be
Mm.
someone who wants to get into a startup or have balance between non-clinical and clinical practice.
Yeah,
I
yeah.
think that permission, that grace to allow for that will reduce our overall burnout because I think burnout's not it's unique in many ways to physicians and to those that are working in healthcare,
Mm,
but it also exists amongst lawyers, amongst engineers, amongst people who are in entrepreneurship. And when I talk to people in other industries and hear why they're burning out, the common thread I feel like I hear and see is that people just don't feel like they get to do all the things that are fulfilling for them.
yeah,
And
Hmm.
that means that if your cup is filled 60% by your clinical practice and 40% are broken down by some other couple things, we should give that
Hmm.
permission to allow you to want to explore those things too. And
absolutely.
so that's something I would like to see more of. And then one other thing, it's not so much permission, but one thing I just hate about how we interact with each other, and I want to
Hmm.
see more of is let's call each other by names, right?
Yeah.
Let's like
Yeah.
stop with the whole like you're in the OR like anesthesia. No, like learn their name, right?
Yeah.
Like on a consult, if I'm talking to someone like, "Hey, how's your day going? What's your name?" So I can call you when I text you or call you, I can address you by your name. It just it's a little tiny thing to make you feel a little bit more human and for the workspace to feel a little bit more have that community vibe. So
I tell you,
that's
that's
just my
American,
own
I think.
personal thing.
Okay.
I think that's
Yeah,
American because
yeah, yeah.
I did not experience that in the
Mm.
UK. And when I
Huh.
nowadays listen to Dr. Glaucomflecken, if
Yeah,
anybody
I was
knows,
thinking the same
okay,
thing.
I always think
Yeah.
he does it simply as a parody because rather than give his physicians names, he just calls them by their specialty. But hearing
Right.
Zen speak, I realized,
Yeah.
I think it's a thing in America where you actually call ortho instead of saying, hey, doctor, what's his name? Or in England, they just call you by your first name. It's become
Yeah.
that personable in the UK.
Hmm.
But
Yeah.
yeah,
Hmm.
I
Hmm.
was
that's
thinking the
interesting.
exact same
Yeah.
thing. And also, it's kind of a depersonalization. And I think everything you
Mm,
said, Zen, goes back to
Yep.
what Gregory said about
Yes.
doctors being able to be human. And humans have names and call them by their name. And
mm,
also, speaking to grace and permission to have other interests, Dr. Charity Hicks writes a chapter in our book, Feeling Better Outside Medicine to Feel Better Inside Medicine, speaking to that if you
mm.
can nurture your interests
Correct.
outside of medicine, it can sustain you and fill your cup.
Inside medicine, like it.
Yes, yes. So, oh my goodness, I wish we could
Yep.
talk for
Yep.
much longer. And I just wanted to thank you again for being my guest today. I really appreciate it. And I'll link your contact information in the show notes.
Okay.
Okay. This was fan
Awesome.
this is fantastic. So if today's conversation resonated with you, as I mentioned, you'll find more stories like this in our White Coats book series. And for those who feel called to go deeper, we'll be gathering this October at our inaugural physician retreat and would be honored to have you join us. Links are in the show notes, including how to reach out to our guests. And if you'd like to support this work through sponsorship, I would love to connect. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.